Item number 2, establishment of a quorum. We have Commissioner Diaz, Commissioner Santana, Commissioner Barnes, Commissioner Avalos, and Commissioner Glenn present. Item number 3, public must comment to notify the board to speak on certain agenda items. 5 minutes is the allotted time. Public can comment by calling 915-213-3008. That's 915-213-3008. PIN code for this meeting is 292-055-645 # 292-055-645 #, or in person in a sign-in sheet and will be provided. Commissioners, anything out of consent agenda you would like to pull out?
Negative, sir. Motion to approve.
Second.
Was that Commissioner Santana?
Yes.
I have a motion by Commissioner Diaz, second by Commissioner Santana. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
Commissioner Barnes, Commissioner Avalos, Commissioner Glidden.
Aye.
Motion carries. Regular agenda, discuss an action on adopting the district's 23-24 budget or proposed budget. Sure. Commissioners, can I have a motion to move the insurance one up to the number 8?
Second.
A motion by Commissioner Avalos to move number 8 up to the front of the line, second by Commissioner Diaz. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
Commissioner Barnes, Commissioner Avalos, and Commissioner Glidden.
Aye.
Motion carries. Item number 8, discuss and take action on healthcare insurance, submitted by Chief Esparza. Go ahead, Mariana.
Okay, sir.
If you recall, a couple meetings ago, a couple Tuesdays ago, we had discussion about the health insurance, and I know we're meeting still this coming Friday. Mariana, is that correct? We're going to be meeting with a broker this coming Friday. Keep in mind that we still ask for the rates just so we can kind of give you a picture, a broader picture. Your current Cigna plan is at, per employee, I'm going to give you the employee rate, okay?
This is in your Dropbox, Commissioners.
Yeah, if you look at the current employee plan, you have 33 people enrolled in the plan. Just on the employee alone, you're paying, your current rate is $762 a month. For a Cigna plan that, as I mentioned to you before, depending on the territory, some hospitals will accept it, doctors will accept it, some won't. Blue Cross Blue Shield in the El Paso area has been the most popular, best coverage. You want to go get blood work. I speak firsthand, not only for myself, but for other clients and employees. We don't ever get complaints from PPO plans from Blue Cross Blue Shield. The only complaint we get is that Blue Cross is notorious for doing increases every year, regardless of your losses, okay? However, if you look at your spreadsheet, you look at the current rate, the Cigna plan, the renewal rate is right. I don't know if you see it on your page, but if you go to the Cigna, it's at the very top. This looks like this. Okay. You see the 700 current employee rate, and then the renewal rate is going to be $834. So you're looking at about 20% increase just on renewal. Okay, it's another 130, 140 bucks. Okay. Based on Commissioner Avalos' recommendation to try to see if we can cover the employee and family. So you have different options there. They do employee plus spouse, employee plus child, and employee and family, right? The employee plus spouse, if you were to do it now and it was a current rate, it would be about $2,716. And at the renewal rates, you're looking at about $3,200, just over $3,200. What does that mean? That means that employee plus their family, and when it comes to family, it's spouse, and it doesn't matter how many children you have. Okay, you can have 1 child or 10. Your annual, right off to the right in the center of these two spreadsheets or these two columns rather, is 1.28. Okay, $1,280,000 would be costing you. Your current at renewal will be about 330,000 is the current right now, annual, correct? Or is that what, did we determine that was at renewal at 330,000?
Yes, it should, let me, it's not
For
over.
employee only, you're looking at $330,000. So if you cover the family, yes. Sir. If you cover the family with Cigna through renewal, you're looking at about $900,000 additional out of pocket from the county.
Through Cigna.
No, this is
Sorry.
Cigna. This is strictly Cigna. I'll get into Blue Cross Blue Shield's prices.
So,
This is strictly Cigna. Yes. The 1.2 through Cigna.
So that,
Okay.
so just to say, as we were discussing, that's the highest that it would cost. Not everybody's going to obviously. include their
assuming
family. So that's
everybody take it.
assuming, this is assuming
Yeah.
the 33 full-time employees.
You have to budget for that because
Yes.
if you got to assume that everybody's going to take it.
Yeah.
Mr. Cano,
So,
Mr. Cano,
yes, sir.
as far as on the Cigna, this is only through VFIS, correct?
Yes,
Yes,
VFIS is
fully
our
through
broker.
VFIS.
Yes.
But this is a Cigna plan. This is what we're looking at right now.
This is your current plan.
This is our current plan.
This is your,
Cigna.
Cigna is your current insurance provider.
Got it.
Okay.
Got it.
And so if you stick with Cigna and you renew, which they're giving us already the renewal, and you just stay with your employees only, you're looking at $134 increase per person per month. Okay, so they're coming at again, a 20% increase. I don't know why. I don't know if there's a lot of illness, chronic illness. I don't know what the increase is for, but we could talk to the broker about that. But right now, for preparation purposes, money wise, this is what you need to look at. Okay, that's what he's saying right off the gate. You're looking at 1.2 if you want to cover the family through Cigna. Okay, now, any questions on the Cigna?
No, sir.
Okay, now let's turn over to the Blue Cross Blue Shield. You should have one that has like 4 different, at the very top, you'll see P3, P4, P2, P3, and P1. You see those?
Yes.
Okay, so let's focus on the P3 and the P4s. And why am I focusing on P3 and P4? Because these are PPO plans, which is if you want a better plan, if you want these firefighters, they're out on vacation, they're in California, and they get sick, a PPO plan is going to be easy going for them. They'll go into a hospital, doctor, what do you have? Blue Cross Blue Shield of Texas, PPO plan. They won't even bat an eye. Okay. So those are the 2 best plans. So if you do, let's go to P3 at the very bottom, same number of enrolls, 33. Look at their rate, $694.78. It's even lower than your current rate per employee. You're at 700 right now. Your enrollment is going to come in at $834. Do you follow me?
Mhm.
So if you go this route, this is the first PPO P3. This one, if you go down a couple line items from very top, you see where the 3,000/6,000. That's the out of pocket by the employee. So it has a higher deductible out of pocket. If you go to the P4, if you go down again, same line items, you see 1,500 to 3,000, I believe, 2,000, 3,000. Sorry, I forgot my glasses. So this is a better plan because out of pocket, they will pay less, if you will. And if you go down to the very bottom of it, you see that the rate for a better out of pocket for the employee, the rate will come in at $719.90 per employee, which will be about $20 more than what you're paying now through Cigna. Do you follow me?
Sure.
Okay. So annualized would be approximately 285,000, which is lower than what you're paying, what you'll be paying Cigna. And it's a better plan. It's a PPO plan with the much lower out-of-pocket deductibles. Okay. This is what I was talking to you a couple weeks ago and said, let's try to shop it for what's best for them. If you look at the current Cigna, and I'm sorry to, I'll go back and forth, but if you look at the current Cigna, look at their out of pocket. 1,000 out of pocket. So yes, the PPO under Blue Cross is just $500 over, but it's a better plan overall. Okay. If you were to do family, which is what you brought to the table, Commissioner Alvarez, if you go down P4 and look at the family pricing, it's $2,159.70. So annualized, the P4 under Blue Cross Blue Shield, you follow? The Blue Cross Blue Shield P4 and go all the way down. Okay? You don't have it?
I'm trying to get it on your
Oh, I'm
monitor,
so sorry.
commissioners. Okay,
So it just trust me on these numbers. They're, I think everybody else can see them. If you were to do the whole family, okay, through Blue Cross Blue Shield under that P4 plan, PPO plan, the whole family would cost you $855,241 instead of 1.2. Okay, so just on this plan alone, you're saving $400,000 just on this plan alone. So
That's on the P4, correct?
on the P4, yes. If you were to do the P3, it would be $825,000. But the P3 is just more out of pocket from them because the deductibles are in the 3,000 range. Yes, sir. Here, I'm gonna tell you what we've told other municipalities. Yeah. So I'm glad you asked that question because I'm gonna tell you what I've told other municipalities as consultants, okay? If your constituents, the people who are putting money into this, have these kind of plans at home, you have to be apples to apples. But if your constituents don't have, they struggle to make minimum wage, they struggle to make their payments, they struggle to cover their families, and the taxpayer doesn't have this type of coverage, that's not apples to apples. So you, right. That's not good business practice. I mean, no. And I'm not a CPA, of course, financial, right. Well, I mean, I think just the fact that you cover the individuals that are going in and out those fires and bring them into a better plan, a PPO plan that is, that they won't be told, no, we don't accept those plans. I mean, Cindy, I know she also has clients that have these type of plans and through VFIS, and we get those calls where they can't even get blood work done correctly. So what would I do? Again, yep. Mhm. Okay. Well, I mean, if you look at, let's just say that for the time being, they don't cover their children. Let's just say that, and they want to cover their spouse, right? Even if they decide to cover the spouse versus the children or vice versa, the rates are the same under this PPO plan. You're looking at 1439. You as a company, you're as a district, you're already covering the employee aspect of it. So they're only out of their pocket would be looking at $700 a month. I know, and I say only in comparison to paying $1,400, where again, think of your taxpayer out there. Think of your neighbor. Ask your neighbors out there, the ones that are contributing to this. Hey, do you, where you work at, are they covering your whole family? You know, you need to ask yourself that question. If the answer is no, again, it's not a good business practice, but I'm also not a certified financial consultant, so I couldn't really tell you.
So if you want to
would.
alleviate, obviously it's extremely expensive. It's not business smart, straight out flat, transparently. But if you're concerned about catastrophic events in families, corresponding to their significant others, household members, things of that nature, there's a plethora of supplemental insurances that are going to be a lot more cost effective for the entity. And if you wanted to adopt a particular type of supplemental insurance and cover that, it's going to be much less expensive and it's going to be a little more comparable to what you're wanting to achieve, right? But at the end of the day, I think that the district's responsibility or goal would be to cover those people that are working for you, especially in the line of work that they're doing. But there's plenty of supplemental insurances that are, you all can pay for that in lieu of a full-blown major medical health plan. That's an option. I mean, you could also do an employer contribution amount for a dependent plan. Also, that's gonna, you're able to control that because it's a fixed amount that you're giving that. But you just have to be careful when you start doing that, because now what about people that don't have dependents? What about people that don't have a spouse? So there's a lot of, it's not a very straight arrow answer. There's things you all also need to take into consideration with individuals that those particular employer contributions or extra monetary contributions don't apply to. So it's not really just a straight answer to that.
I know that you, in the previous meetings, especially, I know we're talking about apples and oranges here, but we talked about the stipend program and you stated, some of you stated, we want to have a sustainable program, right? This has to be a sustainable plan. By that, I mean, what's the point of offering it to them? Because it's an annual thing. And then next year, your budgets are not where they need to be. Okay. And if they're not where they need to be, guaranteed that health insurance plans, they go up. Everybody knows that. Okay. It's no secret. Is it going to be sustainable then? And are they going to essentially get a taste of something that they want and they may potentially not have the following years? Let's look at this Sleta school districts. Let's look at El Paso school districts. Let's look at entities that are, again, sustained by, taxpayer money and all that. And what happens? They complain because they're going to be given an increase, but then their insurance plan went up 3%, 5%. Comes out on the news all the time. So we hear it even through our client base. Okay. It's a great thing to do, but again, ask yourself, is my constituent, are they riding the same wave? Do they have the same plans? If you can just at least offer a very good plan to the employee. And I speak also from a personal experience that my wife works for Canutillo School District. And if you look at her checks, you would laugh because her checks are like $20, $100, $30 because she's paying for our health insurance. Okay. And it's almost an embarrassment to her. She says, wow, and I tell her, no, you're working really hard to cover us because, and we have Blue Cross Blue Shield PPO plan. So I'm telling you that I'm addicted to Blue Cross Blue Shield PPO plan. Absolutely. Absolutely. Right. Absolutely.
I know we're not voting on it today. It's for informational purpose only, right? Because we're still gonna go talk on Friday to,
Yes.
okay. Well, anyway, my point is just something to think about. Instead of doing employee, spouse, and family, that triples pretty much what it costs us. How about we could go employee, spouse, or child? And if the employee wishes, they can add family. And that would be it would just double our cost. And it's more manageable. I know everybody now is working, my wife now we pay about $550 a month.
Yep.
So, I mean, everybody has to pay insurance now. What we wanted to do was to pay for everyone, which is a noble idea, but I think if anything, just something to think about. We can do just employee and spouse or employee and child, and the employee can add the
Family.
other part if they want to.
Absolutely. And just keep in mind, you know, the focal point is return on your investment, okay? It's not just paying for insurance, but $500, even if you pay $120, you want something that you can use and nobody's gonna tell you no for it. So that's, and the good thing here is, of course, the Blue Cross Blue Shield is coming out way lower than Cigna is. So
Yes.
that's a big, big plus. So just thanks for, any questions?
Mr. Cano, you're emphasizing on P4
Mhm.
and you emphasized on P3. I know P1 is like, you said that's just an HMO.
Yeah, the
And-
HMO plans are, you gotta stay within the network. I'm not the insurance expert, of course, but just based on practices and experiences with brokers, the HMO plans, you know, it'd be probably a little costlier if you get out of the network, okay? So you have to pay a little more out of pocket. The PPO plan is, you can go anywhere in the US and they'll, it's still considered the network.
Chief, just,
I was just gonna say that PPO, you can go straight to a specialist and you don't have to go through your PCP.
yeah, I mean, under my insurance, I mean, mine's like, it's Cigna, but it's like, not like the P4 or the P3. Mine's like a P2. But, you know, I mean, it just depends. I mean, it just depends. My deductible on a yearly basis is $3,000. It's like $3,800, sorry, $3,800.
Yep.
That's my deductible, and that's just me by myself.
Mhm.
But Chief and Mariana, and on a consensus, I mean, do our firefighters, do they go out of town? Will they need the insurance out of town? I mean, this is where we need some legwork done on, you know, whether it's gonna be done here or they're gonna be out of town. And how many of them would be willing to sign up for it and pay for it? You know what I mean?
As far as which plan, Commissioner?
On, let's say, from a P2 to a P4,
The PPO?
yes. An HMO to a PPO.
Well, I think the security that like Mr. Cano said is that with a PPO, you get to go anywhere without restriction. Anywhere in the United States. With
That's
the
either going
HMO,
to-
you're gonna have to go there and hope that the hospital they take you to in an emergency is within network. If not, you're paying whatever it's gonna be out of network cost plus your 20%.
And we can ask the broker on Friday, what are the pros and cons? To your point, you know, today you're looking at cost. Right now, you're looking at, okay, how much is it gonna cost us?
Right.
If you go the best PPO here, which is the P4, then at least you know that it's gonna cost you $855,000 if you go through the family, right? If not, you're looking at $70,000. If you were to cover, I think this number's, that's $70,000 a month, right? Mariana?
Sorry, I was looking at something else.
You don't think we need to get the calculation of this 1439 times 33 times 12.
I got
this
fi-
70,000. So if they were to add employee plus child. $570,
I'm like confused at what, I'm looking at something
I
else.
need my glasses. I truly do. I thought there were the dollar signs. I thought 70,000 is wrong. 570,000 if you do spouse or if you do children.
Mhm.
If you want to keep your marriage, you gotta go with left.
Well, it's something, I think it is a little more. Yes.
This is more what insurance folks
Yeah.
Yes.
So for
But they're gonna
the,
do the family and the employee is gonna have to pay the difference.
Mhm.
So difference, you're looking at, it's almost tripling. So if you do the spouse, it's 700 additional dollars that you're covering if you wanted to go that route. And if they say, well, what if I want to cover out of my pocket, my children? So now the plan changes to employee plus family. So the 1,400 that you're already covering your employees, they would pay the difference, which would be another $700 to get to the 2,159 a month. Listen, to cover the whole family, $700. I wish my wife had that. Because and I'm talking about the gold. And nothing tells you that,
that's when the accidents happen.
and we can ask the broker, but you know, you can present 2 plans. You can do even 3 plans. You can ask the employees, do you want a P1, P3, and P4? Or if you want to present all 4 and then let them select, at least you know budget wise, you're looking at worst case, you know, 570,000 if you're just gonna do either the spouse or the children. Absolutely. Again, Mariana's said it earlier, right? This is worst case. And I said worst case, if all 33 have all their either children or their spouse or family in it. This is the number. I don't necessarily get involved too much in your
Commissioner,
budgets.
that is not sustainable. And I'll tell you why.
Oh.
Every year, for the last 5 years, our insurance increases about 20% every year. There is an increase of about 15 to 20%. Okay? Now, take it that this year our special projects came at a very low amount. What if in 2, 3 years we need to replace something? We're gonna have to choose between we continue to coverage the employees and their families, or do we do that special project? It is not exactly. So
And if they're increasing, I need to ask the broker on Friday. What's the purpose of the increase? Why are they focusing on zip code, on the general population? Are they zeroing in on our staff?
census as well, the census,
The census, because now you're adding spouse and children, so you may be adding more chronic illnesses. So that 20% could be a little higher next year. So I have to use the word sustainable because you used it last time. So I want to make sure you all understand that you don't want to give them a taste of it and then not afford it next year. Yes, Commissioner. Yes, sir.
Tom Newby.
with Tom Newby from BFIS.
It's a Teams Zoom meeting.
No,
right?
he's gonna be here.
Oh, it is? Okay.
Mm. He's giving us here the option.
UMC,
It's,
UHC, United Healthcare.
yeah, United Healthcare, Blue Cross Blue Shield, and Cigna.
Yeah.
Okay, we currently have Cigna.
Yeah, my questions are gonna be, you know, which ones of the 3 are being pushed back by Del Sol or Providence or Sierra? Which ones are, you know, in the event that they need to run, oh, sorry, they don't take your insurance here. Just stay with us. We're gonna bump you up to the UMC. Who knows? So again, we've not heard anything negative, right, Cindy, on Blue Cross? Um, United Health, uh,
beneficial. It's not just when you travel, it allows them to go anywhere at any given point in time, 24/7, as long as they take.
Oh, sir, thank you.
Very good.
Item number 8 for informational purposes only.
Just to clarify, are we coming back next Tuesday to vote on this? It's 30 seconds.
Yes, next Tuesday, we're potentially taking action on it, right? Once we have all the information.
Right now.
You could have taken it today, you could have taken it,
I would recommend you take it today because the next item is to propose a budget and then the following is to propose a tax rate.
The only thing, Mariana,
Mhm.
as far as that, if y'all are meeting on Friday with somebody else, I mean, what happens if we get,
We can come back in the next meeting and adopt the budget. Right now, you're just gonna propose the current budget that I have in there so that you can see also the different scenarios of proposing a tax rate. Because we need to do the proper posting before August 28th. Is that what Ken said?
I believe
Yeah.
so.
Before August 28th.
We don't want to adopt one then after. Fine, I mean,
Or you can just adopt the budget as it is, not adopt it, I'm sorry. Approve it as the proposed budget. And then next week, next meeting, not next week, maybe the following meeting. You can include the cost of the insurance and then adopt the actual budget. We can just leave it as information for now.
So just to clarify, Friday's meeting will not change what they looking at.
No,
Friday, we're talking about clarification, the new rates, research, and that's the thing, so we don't have it.
Yeah.
And you think that's based on your experience and what you do every day. So it's gonna be these options.
Yes. And that's the same thing that Mr. Newby said, that the best one right now is Blue Cross Blue Shield. They came in one lower, way lower than the other one, to be able to cover a lot of it.
Awesome money, but I think if we can afford it and we can help the firefighters out with the one where it covers either the wife or the kids. I would ask that we consider doing that. If we have the funds available for it, I think that would be free for years, and also it's zero on. It'd be a good thing for our firefighters, right? We can't do the other one, because it's not just, that one definitely we can afford, it doesn't make sense. But I do think that if we can do this, one, and they're giving them the options. And if they, their wife is covered and then they decide, hey, we're gonna pay, the other one, we're gonna pay kids. And it's not very cheap in mind, and everything else, I think that there's a change, and I know it's going match a lot of our communities. And I'm not a firefighter, but I will say, most of the communities were going to be like food section. Most of our community business have outside of that first responders and military, why kind of home learning when not giving them some kind of shift, like it's.
well, also firefighting, only 50% of that, we still have, it's something to say, I don't want to limit the firefighter, cover everything, right?
Right.
For everybody.
Okay, but I do think that we can, when asked to be considered about the, this every point.
Another thing you need to consider, because again, and I hate to make comparisons, a municipality that hired us back in 2017 to do the same thing, look at the plans, and they were offering to family and was it just children, Cindy? And the fees, I mean, you're talking about $1,200-$1,300 back then in 2017 to cover family and children. And they hit a wall the following year, and we explained to them, based on your budgets, based on the revenues coming in, taxes and all coming in, you're going to have to either do pay increases and do away with the family coverage, but you won't be able to keep both. And so obviously the mayor didn't listen, and they ended up hitting that wall. So employees were upset because they were asking for pay increases, but they couldn't because they had this plan. And when they try to take it from Paul to pay Peter, it created a very irate group of people. So you have to consider that you also have step increases that we talked about that you already approved. So it's not just a sustainable flat line, plus let's throw in a little bit of insurance cost in there. You've got, every year, your salaries are gonna be going up, so you've got another load that is coming, so you need to also be aware of that. Because, I mean, as a professional, as a business owner, I would probably put that money and have it in reserve, so to speak. It needs to be used, but I get the potential issue that they encountered. And they weren't able, to date, 6 years later, they're still weren't able to recover from it, so. I just want to alert you of that, okay? They went to another plan that was dirt cheap, but they get denied every time they go, so they have to pay out of pocket. So just another thought to consider.
Item number 8, discuss and take action on healthcare insurance.
Was that motion?
Yeah,
I have a,
Okay,
I'm not making a motion to do anything.
oh, he called for a motion. Commissioner,
Let's discuss, or we want to, see how you all feel about it. I'm just thinking we have the info either.
We signed commissioners to it to come take a look at in depth, do a deep dive into it with this.
Well, we need to make sure that we can pay, we know what our budget is and what we're allowed to have.
That's what I'm saying.
If Mariana is telling us we don't have it, then we need to be careful.
Aaron, just all the numbers in your head. What's our payroll budget percentage of our payroll? What's that? What percentage is that of our budget?
it's about, no, I think 35%, about 35%.
35?
This next year, so this estimated payroll, we just updated it, so it should be
No.
updated it right now. Your salaries are going to be 2,036,000.
So almost
Okay.
46% of our budget is in 3 line items right now.
That's just the salaries. That's not including your payroll
Okay, payroll.
taxes and
Yeah,
your
that's not-
pension.
Get that.
Yeah.
Is that sustainable, Tommy, or is that something from a business practice? 40%, 40+% of budget?
It's at 35. right? I think it's 35.
But the biggest thing, if we give someone healthcare, then we have to go back in 2 years.
So right now we did review, and I updated the different scenarios of the budget on the Dropbox, and you'll see there's the updates. So before we had a higher amount of surplus for if you went to the de minimis rate, I believe it was at 920,000. Right now, we did an update on some of our salaries and that went down to 719. Okay. It goes much lower for the voter approval. You had it at 527,000. Right now, it went down to 326,000. And the no new revenue, you previously, before the update, was at 431,000. Right now, it's at 230,000. Now, as Tommy mentioned, if you're going to, you need to consider the changes and the 20% increase every year that I'm seeing for the past 5 years that I've seen with, and we've only been with Cigna, what, 2 years, Chief?
Mhm.
2 years before we had Blue Cross Blue Shield, but it went up extremely higher than a 20%. So that's when we decided to go to Cigna because they were giving us a lower rate. Yes, and now Cigna is at 20%.
it's a teeter-totter effect with the insurance. We have to review it every year, and every year we have to make the best call, which what keeps us in line. The only other option that I could see, Commissioners, if this is the hard part is, and I know that this is not something that you've all ever wanted, is to give the employees the insurance money that you pay now and let them go choose where they want to go. Because they might go and pay for with the Obamacare, they might go and I say Obamacare, the marketplace, they might be able to pay for them and their family. They might be able to pay there for them through there and cover the expense.
Get your thoughts on this?
There's 4.
Well, talking about. No, I said one that does work. I didn't. I don't get to sign in or leave a blood sample up there, but
So, some of the, I understand there's not enough money and stuff like that.
don't worry about that.
The point is to just try, but some of the guys they'd rather keep their money. They'd rather get their money. They,
Didn't get health insurance?
it's a different generation. Like I said,
You're correct.
but I can't do that. I have 4 children I have to take care of. So, there's other employees, Mariana, there's a whole bunch of employees with, children. If it's not possible, it's not possible. We get it, as long as, you're able to try, that's all. And maybe
We're better at that to try. And I think, what's your thoughts for you
for me,
on this plan here?
well, I want this place to be around for me to make my pension. When you guys make it sound like if there's not gonna be enough money, and then one day you're like, you know what, there's no money to pay this, pay that. So I'd rather not take no insurance and let there be money for the continuing years to come, if they come. But most of the guys, it's just that's all they're struggle with, just being able to just, it sucks for us kind of going and asking for help for programs, and they're like, well, what do you do for a living? Oh, I'm a fireman. Oh, we're like, well, yeah, they don't really. Like, do you guys have a part-time job or something? Nah, work Monday to Friday. We don't have enough time to get a part-time job. So, and that's a lot of us work part-time jobs. Pretty much more than half of the paid staff works part-time jobs. Be able to make it. But if there's no money, there's no money, and we get it. I'm happy that you guys are actually trying your best, and I can at least see the numbers, and I'll be able to talk to the guys, but hey, man, they're trying, and right now it's not there right now. Maybe in the future.
I appreciate your input.
Any questions?
Oh, thank you.
Thank you.
very much.
Tommy and Mariana, when we go out for insurances like this, is there a chance that only certain people, how many people would be getting employing child or family? How many of them would it be? Más o menos. Más o menos, and how many of them would it be? How many of them-
Nobody,
How many of them would it be just the employee?
okay, so right now, nobody's using because it's too expensive. Nobody has their child and their spouse or family.
Más o menos, Mariana. And I'm not saying all
3/4.
33 people. I'm saying,
Probably 3/4, like,
3/4 of the staff would get, if
Okay.
it was available, they'd take it.
okay,
Well, I think the better answer, if I may, is that if everybody has a family, either a spouse or a child, they're all gonna take it because it's free.
yes.
So, I mean, I think that's the question. Yes.
Based on our. They go out and give them the money instead. Are there affordable care plans that that could benefit them more than? I don't want to say that the Blue Cross PPO, but. Is there an option where we could say? We keep the same plan for just our employee, if we go through Blue Cross PPO. Or. We pass out and then. We would do it with that. That's something that we discuss, or do we not want to? Go down that road?
Much in the money to get it.
Right, so either they get the PTO Blue Cross, or, hey, you know what, if you can do better at the marketplace, because whatever,
Yep.
if you see me go to the marketplace, like, are there plans in the marketplace? Yeah.
Yeah, I'm not qualified to answer that because I'm not an insurance broker. But based on what we've heard through employees and even people that work for me, they go out to marketplace and buy insurance. Is it the best plan? Not necessarily. They're having to pay more out of pocket. Those plans out there, the way it was built, it's, you know, to have people insured, but when you have a $6,500 out of pocket deductible and you're gonna be covered 100% when you get to $6,500, essentially becomes a no plan. So what do? They end up going to Juarez anyway. So, I mean, and that's true because we're a border city. Okay, and that happens a lot. In fact, I had a client ask me yesterday, as a matter of fact, can we offer Mexican coverage because a lot of their employees come from Mexico? Would we be discriminating well for Mexican coverage? Because a lot of our employees, even the ones that live in El Paso, are going over there because they can't afford the health insurance. To Mariano's point, to everybody, all of you know this, that this just keeps going up and up and up and up. And of course, salaries keep going up, everything's going up. So, you know, you're gonna be looking at I would say in the next couple, 2, 3 years, you're gonna be looking at about a $3,000 family coverage plan. And is it sustainable to you? Probably not. For employee and spouse, you're probably gonna be hitting the 2,000 mark. What you're hitting right now, what you're looking at right now.
There's 1349, 2000.
So just looking at our employees, if we were to go from, they mentioned the Blue Cross, would that benefit them more? Would that be?
Absolutely.
So that would be an upgrade, at least for them, that would be an
Yes.
upgrade to go to Blue Cross, thank you.
Now, Blue Cross is very unforgiving. I had 3 employees that lost Blue Cross because they missed payments. So if you give them an option, we pay part of it, they pay for the children.
Mhm.
As soon as they miss that payment, they're off the books, aren't they?
A couple payments and then you're off, yeah.
Right, but the insurance here would be deducted from payroll here.
But I'm talking just employees, right? Not
Right.
family
Yep.
or wife, just our employees. So it would be better, it would be an upgrade for them to have that plan.
But it would include the family.
Would it include, that's the.
I contemplated want to share this with you, but just because you need to know, in the event that, at Cindy's point, catastrophic. I have a business client, very similar aged, similar issues that I encountered medically. And I called 2020, called the Mayo Clinic and they had me in within 3 months. Okay. Same situation. He calls me and says, what did you do? I said, I just called and they took me in. Well, they're giving him the runaround and he happens to have United Healthcare. So
Insurance plans drive that train, don't it?
again, I can't say enough about Blue Cross Blue Shield
Right.
for that same reason. But I'm telling you, personal experience, and that's something you should consider. If you want to, again, offer them the cream of the crop. Is it going to be Blue Cross Blue Shield next year? Maybe not. They may break a contract with the Providence and Sierras and whatnot. But at the end of the day, what you want is a PPO plan can be accepted anywhere because you want to cover them anywhere they go. Okay.
Understood, thank you.
Item number 8, Commissioners, discuss and take action on health insurance. There was a motion to, would you,
Well, based on the information that's in front of us and thinking of the future and as mentioned, thinking of the pension plan and everything else that we got. Make sure you get to reach out to those reasons, reach out, CPO, and use for our.
Well, right now, Blue Cross Blue Shield is a cheaper anyway, so you would be going to that anyway, right?
right,
And probably go to the more expensive and not the,
The P4.
right.
Yeah.
I'd be going, choosing P4.
Be the 570, correct, Tommy? Or the
Five-
855? Tommy? If they go with the option P4,
719. 1990.
and it doubles.
yeah, but if they're choosing for the employees and family, it would be the 855
Or children.
if everybody.
Just the employee.
No.
No, they're going, that's what I'm saying, which one are they going? Either side.
So the option P4 is, if you look at deductible types, individual, 1,500, out of pocket, 3,000 max, family is 4,500, 9,000 max. So just based on, if you look at the copays, PCP copay on that Blue Cross Blue Shield, they're paying $45 out of pocket. On the P3, it would be $0 if they go to their personal primary care physician. So, but again, you know, you got to look at the max. You're talking more hospitalization. You know, when they really need to be taken care of, it'll be $1,500, 2,000 max. Okay. It's a,
That's in your line, is that doable?
yes,
I think that's doable, $50.
Absolutely.
You know, it's a big pay, it's a lot of money.
absolutely. It's easier to raise $1,500 through friends and family and GoFundMe than $9,000.
So my question to the board would be, go with the plan being suggested for our employees. There, is there an option to allow those employees to cash out in lieu of the P4, or do we just want everybody to get the P4? So, I mean, I know at this point, it's not sustainable to do the either or wife or kid or wife and I mean, the numbers are there, right? We can't fudge numbers, the numbers tell the truth, but if we're gonna improve our employee health insurance, do we do that, or do we also give them an option, yes, I want the insurance, or no, I'll pay, but you were gonna pay the insurance anyway? Thanks.
There's different ways to skin the cat. You know, if you're looking at, again, the employee spouse, employee child, it jumps from 719 as an individual to 1439 on the Blue Cross Blue Shield. Okay. Is it okay just to focus on P4?
Sure, yes.
Are we all on the same page? Okay. So if you know, you could always come back and say, let's do, if you wanted to increase it on their annual salary, if you meet them halfway, skin in the game, so to speak, and they really wanted to cover their children, the one thing you cannot do is be selective and say, well, anybody that wants to cover their children or their spouse, please step forward, and then we're going to give you half of that. You can't do that. Okay. It would have to be all across the board. Now, you have to turn away to see whether or not they're going to use it or not for that purpose. And, you know, your budget may be able to sustain that because, again, the following year, they're going to get a step increase, which we approved a 10-year step increase. So they need to also be reminded that your spouse, your wife had to pay out of pocket. At some point, they need to be reminded that they need to, in order for people to be able to be fully insured, both families have to work. Somebody's going to have to contribute. That's just the way it is. Okay. Because again, I keep reminding you that your taxpayers are probably not looking at the same benefit and they're paying for this, so to speak. They're paying somewhere else, somebody else's coverage. And so I hate to be the very bad news, but it is what it is.
So you're saying, you know, we're gonna pay for employees, across the board.
Mhm.
And we'll give them the option, if they want to include their spouse, we'll pay for half and they pay the other half? Is that what?
If you decide to do half of that contribution, it's another $700, essentially, right?
Right.
But you wouldn't have to pay the additional 700. You could pay 1,000 and just say, we're going to give you $1,000 or $300 allowance on top of your payroll. It's a $300, and we can call it allowance. We just give it to them and say, we're going to give you an additional 300 a month. And hopefully you utilize that to cover your spouse or your children. You just have to pay the other half.
But they have to use the same plan we have. They couldn't go out and get third-party plan. They'd have to use that $300 towards the plan.
Well, it's beneficial because this is a
Yes.
group pricing.
It
Yeah.
is.
If they go out there and try to buy it on their own, which they probably go into the market and might be able to get it, that would be a question for the broker. But if they think they can get something cheaper through the market and the spouse or the wife says, let me cover it through the market with, then that's going to be up to them. But I'm not 100% sure if that would be doable. Okay. And still be able to save some money. Because again, remember, the market is not selling you necessarily a PPO plan cheaper than a group plan. Do you follow?
Mhm,
Otherwise, everybody would just go into the market.
right.
You're in a group with 1,000 other people.
So, again, what is it that you're looking at? You know, who do you want to cover? Do you want to cover the person that's going into the fire? You've done that already. Okay. And what you're doing is you're upgrading to a better coverage. Okay. It's going to cost you $20 more, Mariana. Correct?
If you're going with the.
Current right now, but at renewal, it's going to be cheaper.
Yeah, current rate is, if we stay with Cigna, it's gonna be about a 20% increase. If we go to Blue Cross Blue Shield, that's actually going to drop it.
That is correct.
Currently, budgeted is at a 20% for next fiscal year, and the total is currently right now 332,937,
And if you
which
go to
is,
Blue
which
Cross,
is a little bit more than what they provided. It's 330 on here, but if you go to Blue Cross, you're going to 285.
so you have essentially $50,000 that you're going to save. And you
Yeah.
can put that back into the same plan.
And also remember, commissioners, in the stipend program, there's still an additional cost that we haven't really talked about that we're gonna have to incur, so.
Mhm.
Have to get that from somewhere.
Yes, sir.
Well, I got a question there for the stipend for that item number, but for this item number,
I think based on the information, you know, it's unfortunate, but gotta think about the pension, gotta think about other stuff. They usually do it out there with that. PPO will be before, But again, like you mentioned, they're gonna save money on it. And I would just say maybe we can look at students and something to provide next, for sector. Or thinking,
oh, we don't have to wait till it's 0. I think there's an opportunity here to stop. Just don't let us put off the gas. But keep looking things out. Again, to keep the firefighter, focus on the fire. Don't his family take care. His wife's in the hospital, you're not worrying about that, right? That's a heavy burden, I think, for.
My professional recommendation is that you sit idle on this year because you're taking big leaps with a stipend. You're taking huge leaps and you're talking about a healthy, hit budget wise. If you just on this alone, even though it looks better on the renewal from Cigna that you're saving 50,000, but the hindsight is that you're paying $20 additional per month per employee. So it's another $600 a month that you're paying just on renewal alone. If you go with Blue Cross, you're gonna get hit at $600 a month. Because it's the renewal or if you jump to Blue Cross, it's $720. Do you follow?
Mhm.
$719.90. Your current rate with Cigna, as we speak, is $700. So you're still paying $20 if you go to Blue Cross. But if you were to stay with Cigna, you're gonna jump all the way to $834.
I see.
So yeah, it looks better. You're saving 50,000, but you're still
It's
gonna be
still more.
spending
An additional.
about $7,200.
Do you know the percentage of Blue Cross jumps per annum, per year?
Yeah, it varies.
Depending on
It varies.
our claims, your health.
And that's what I'm gonna ask on Friday.
Your
Is it,
everything.
yeah, exactly.
I
Is
mean,
it,
history record from Blue Cross versus Cigna? Is there?
yeah,
increase?
10% is back in the teens, the 2012, 13s, 14s. We were seeing a steady increase by Blue Cross at 5%, regardless of how well you manage your claims. And now they're in the double digits, 10 to 20%. So it's not working in your favor, so to speak, based on your budgets. Okay.
Carlos, would you like to make that motion to at least offer the employees that, the better plan?
yes, sir, yes, we can start then.
We can do something.
We can do something, yeah. Yes, sir. Motion to offer the employees, now we just talked about the better plan, which I guess is the Blue Cross before. Get that approved,
It's only for the employees, correct?
yes.
Yes. Second.
The recommendation, we continue to shop and.
Absolutely.
Drive. They're out, they're out.
And we're still gonna have that meeting with the both of them.
Well, motion by Commissioner Avalos to offer just the P4 plan through Blue Cross Blue Shield. Second by Commissioner Santana. Commissioner Diaz,
I,
Commissioner Santana.
Aye.
Commissioner Barnes. Commissioner Avalos.
Aye.
And Commissioner Glidden.
I,
Motion carries.
We're not giving up.
That there's gonna be an additional.
Keep the faith.
Please.
Commissioners, can we move item number 11? Up to the top? The stipend program?
Yes, sure.
Oh,
motion.
not the stipend program.
That's
Which
11.
one? The policy?
The policy, yeah.
Stipend policy?
Correct.
Motion to move item 11 to our next topic.
Well, motion by Commissioner Avalos. Do I have a second?
Second.
Is there a reason to move it up or just?
Mariana requested so she can put it on the budget for
So
the,
I can update the budget stuff right now while you are discussing that. And if there is going to be an added cost to the stipend program, we can also include it in the budget for when my items come up.
Commissioners, that you all have a time to read the policy on Dropbox,
Yes. Oh,
correct it, reword it, wordsmith it.
we're still missing, I know I talked to Adrian, I want to add some stuff to it for review by the chiefs and everyone. Cause there's not an oversight program or a quality assurance program in the district to ensure this is taking place. You know what I'm saying? Have it's SOP guy here. And to ensure fair and equitable practices across all the states. Which I'm sure the chiefs are gonna do a good job, but sometimes there might be oversight. You know what I'm saying? And, I see you did cover some of the punitive measures, but they're very vague. You know, 2 missed, 2 strikes, there's no exceptions. You know, if I have a doctor's note, I have COVID, I can't make it, I can't make the call, you know, and the other part was the cost, you know, I just don't, I want to get away from the policy, but my understanding, if we went into this was $800,000 cap. Now my understanding, it's over $1 million.
$1,040,000. And that's a 30% just to cover, I'm pretty sure next year it's gonna be closer to probably 900,000. But this year I wanted to make sure we have enough funding for their W-2s and their audit that they're gonna have to do through SBNG and have something just in case something goes awry. But let's be honest, the 800,000 I don't think will be used because a lot of them are barely getting certified. And that's worst case scenario. Again, that is going everybody getting $80. The stipend, we have that if you only one or the other, you get $60. If you have nothing, you get zero. Worst case scenario is everybody gets the $80. That's $800,000. According to, it's 6.25, Mariana, for the payroll taxes. 6.25 for the federal. And then I think it was $2,000 for them to do W-2s for everyone and for everybody in the departments through SBNG plus an audit. A small audit that they will, or paperwork, the 990s that they will have to fill out. So those are covered on the 30% that I put in there to be able to cover that and still have money left over.
Where'd you get 30%?
6.25, and I added the amount of that SBNG sent me over, and then I added a little bit of wiggle room. So I said 30% is to encompass everything. And I'm gonna tell you that I don't think everything's gonna get used because a lot of them are not to that point yet.
Mhm.
I mean, they could, but nobody's gonna be able to collect the full 80. I mean, out of Socorro, how many people do you have total right now? Fully certified,
That are eligible for this type.
right now. No, I'm saying fully certified. Just a ballpark number. 27, a possible 50. So that number is gonna drop. So next year we'll have a more of a perfect number of how it's gonna go and how it's gonna look, or we might certify more people that are gonna get the $80. But this year, the first year, I guarantee you, we will not exhaust unless we start certifying more and more people to receive the max. And that's our goal.
That's our goal. Yes, sir.
You already did the numbers in your head, chief. What you got? About fire one?
No, it's gotta be firefighter two. It's gotta be firefighter two.
No, no, no. Well, you're saying you have. Okay. Okay. Got it.
So the number's gonna drop. But I have to budget for a worst case scenario.
It would be an extra
If my calculation is correct,
40,000,
I'm sorry?
an extra 240,000.
Yes.
Got a question on the 3-page part. You had item number 5 says ride-alongs provide excellent training opportunities for new members.
In other words, if there's a new member, go ahead.
And I got it. Candidates or members wishing to third ride. I think some stations, you're here, you're on the spot. How many people roll out in your trucks? What's your plan? 3 or 2? So you're gonna cut back to 2? That's what I'm afraid of.
So we were, cause I know that we're gonna be making them required, there's gonna be requirements for them to do additional hours for volunteer hours. So that's where I would plug them in as additional members on the apparatuses.
Okay, because I know some trucks, and correct me if I'm wrong, you speak for all the chiefs.
Yeah.
The chief, some trucks have people that ride out with the trucks. Like, it's 3-man crew, 3-person crew.
Yeah, I mean, that's what you would want, but I mean, it doesn't always happen.
Fair enough.
Yeah.
Fair enough.
That's the ideal situation.
That's the ideal, yeah, exactly.
We did too, because that's right now, if you ask Chief Marquez is also here, even when he has 3, even when he has 3, his normal is 2. Did I not ask you that, Chief? Your normal is 2?
I know, and I don't want to speak in their behalf, but
Fair enough.
West Valley, I know that, because I listen to the radio, sometimes, I know that they run a 2-man crew as well. I know that they probably prefer, to run an additional man, but I know that that's how their shifts are usually run. I usually hear about 2 people on the apparatus.
I got, the other day we had a meeting that one Tuesday, the chiefs were saying, we schedule 3 people on the roster to be at the station to ride in the truck.
What chief was that? Nelly?
Might have been San Eli, but who else was there?
I don't know. I can't speak on his behalf, but
And that's fair. I'm only asking for your behalf. Chief, what do you guys?
We're gonna say, usually on average, have about 2 already. Because of the way we're scheduling them and the requirements that have to fulfill. With the stipend program, because of the fact that we still have that set volunteer hours. The candidates that don't, or the other ones that participate, are still mandated to fill in their. But the things that we're targeting, because it's letting them do it. So I'm wondering if you want to.
Thank you.
Never number 2.
And our paid
I know one was
firefighters,
2.
yeah, our paid firefighters are 2 also, yes.
And
We made the same boat. We only have 11 certified members, so. We don't have 3 per shift, and then we do have a 3rd or 4th member, or candidate or a training.
Fair enough.
And commissioners, again, this is just to be able to put people into stations and be able to roll out faster, more equitable to our communities and be able to show that we're there. Right now, we're struggling because, of course, the chiefs made time to be here and they're struggling because they're having to go to work. I mean, it's a reality. Right now, I'm just trying to put bodies there to where we're gonna give you a little bit so it doesn't cost you to be here. This is not to get you to, this is not a full-time job. I wish I could say we were gonna pay everyone. Because if that was the case, we'd be looking to hire more people. We can't. You saw it. We can't afford it.
I get that. And the other thing that wasn't covered was, you mentioned about people coming down for stations who didn't have people like, how many you sense Socorro could fill in for Sabins,
Correct.
firefighters can meet the requirements, or Sabins could fill in for Clint. Like, they don't have the people.
Correct.
That's not in here.
We're still looking into that to see if that's legal.
So we're not looking to prove this tonight at all.
No, that's a policy. That's the way it's gonna go. That other situation could be on them. Because if they want to allow that, they'd have to be members of their department. Does it make sense? They'd have to volunteer for two different departments. It can be done. The law says that they can only acquire 20% of what a paid fireman is making in this area. 20%, and that's it. So they cannot make it, let's say, a Socorro individual cannot make more than 20% of what the paid staff's make, and they're not gonna get there.
I got
But
that.
we're talking about filling
Yeah,
vacancies.
Yeah, Bob, I'm talking about what is the district's guidance on station chief providing his volunteer personnel to another station? And that other station chief accepting them, and who oversees that?
But that's if the other chief is allowing them as a member, because they do have policies on that. So we wouldn't get in the middle of that. That's only if, hey, can you want to sign up with me, and it will be, you'll be volunteering at two different locations, because we're gonna cut the check to the volunteer department, not to the individual. I'm sorry?
And how's that gonna work? I mean, the paid departments are gonna turn around and pay the employee?
That's why we're budgeting for SB&G to do their paperwork. They're gonna cut W-2 forms, they're gonna do their audit, their 990s, they're gonna get everything squared away.
I personally don't see an issue.
I just
with,
want to make sure they don't get in trouble.
Well, yeah, well, I don't see it, but anyway, firefighter from Clint going to work in
Yeah.
Fabens.
I don't have a problem.
As long as they stay within their hours, I mean, are we gonna be able to keep track of those hours?
It's, so on the program I'm currently looking at, and it's not the final one, we're gonna be looking at another one from here to October 1st. It's gonna be 6 different schedules. Each department will have their schedule. Each chief will be able to make their schedule that way they want
Right.
it.
Right.
We will be, so if a chief, let's say, I'm gonna use them as an example because they're here. Socorro is using a member from Fabens to cover his shift. That name will just pop up at Socorro as well. But he's gonna receive a paycheck from 2 different departments. if you
Right.
would.
And is
So-
there any chance that he could go over though?
No, because it's not the same money. It's not the same money.
And that's where the legality comes in.
It's not
Yeah,
the same money.
Who's tracking that?
Same hours.
Let me,
yeah, you can share firefighters.
let me give you a scenario. Okay, so let's talk about that. You're volunteering at Horizon, then you come volunteer here. You're getting a stipend there, you're getting a stipend here. What's the difference?
Who's managing that individual's
It's all ESD too.
total time?
I'm sorry,
It's all ESD too.
but we're not paying the individual. It's the volunteer, and that's what the law says. That's why Ken is saying it has to go from their Inc. account.
I see.
We are not paying them. It's the volunteer department paying them. We're paying the volunteer department to do it.
Reimbursed.
Yes,
So they could be working more than the 10
they
shift.
could potentially be doing 24 hours at Fabens and 24 hours at Socorro.
Is there no cap though?
But
There is a cap
So, but it's gonna be per department.
per
per
department.
department.
What's the cap?
It's 24 hours in a 7-day period or 20% of whatever the paid fireman, the starting paid fireman makes
So
here.
there's no amount, like a actual accounting amount? 12,000, 15,000?
As far as,
It's 800 a month.
Is it, okay, that's what I was
Right.
asking.
it depends, because I
If-
don't think anybody's gonna be working the 10 possible days.
Sure, but I mean, that's the.
That could be.
Yeah,
Okay,
up to
but
800.
there is at 800 a month
Mhm.
for the, okay.
And when are we gonna find that out though? If it's legal, if it's allowable, or we already know they can do it,
No, I'm still waiting to check with Ken. He didn't return my phone call.
so.
That prior to, I don't know if this is good or bad, but prior to each shift or each day, there would be an email sent out by the chiefs saying who's working that day.
So the software that we're looking at does all that automatically. Once your name is plotted, it sends you a reminder, it sends you when you're gonna shift, and there's an app for it. That's why I like that one.
Going back to, we had a conversation on this last meeting, so the chiefs would be sending that out.
Well, the chief's gonna be entering the schedule.
It's just a reminder.
Yeah, no, it's a good reminder, because I think where the confusion is gonna be, firefighter Barnes is gonna be scheduled at 2 different places, potentially.
Okay.
And that's why, who has overall Who's the belly button for district to make sure this is running correctly?
We will be looking at that, but at the end, they're the ones that are having to look at it. Go ahead.
So we already have a similar system, and I know the district uses it as a communications app as well. We use what's called Crew app.
Yep.
So you can set an alert of when you're gonna get the notification of when you have a shift assigned to you. So you can set it up to 24 hours, 72 hours. So that's what I do. So my guys don't have, an excuse that, hey, I didn't know I was scheduled.
Yeah.
So now you have that paper trail of that shift assigned to that person. So it's just informational, purposes of, because I know the district uses it as well, but it's more of a communications app for them, because I understand the different scheduling. We use it as a schedule. So you're able to assign, you're able to do the scheduling as a calendar, and they're able to see it as well. So
On the schedule that I'm looking at, what's it called? When am I working? You can set the parameters, and that's what I'm looking to, that's what we like for us to be able to look at. You can set the parameter, individual so-and-so cannot work more than 24 hours in a 7-day period. And it'll keep that. If the chief allows a 6 hour for, let's say, Mr. Santana to work Monday, 6 hours, then it's gonna deduct from the 24 hours. And then if Tuesday you do 8 hours, it's gonna deduct that. And then it's gonna send you a notification that you're about to exceed your allotted amount.
But if I work, now, if I'm working for Clint, because Clint more likely to be the one who needed assistance.
Mhm.
Will that track that?
They will track
When
that.
am I working? Is that a fire app or a .com?
It's a fire app. That's what the districts that I spoke to are using. They're very happy with it. I was looking at their videos today. You can set the parameters, you can set when to send a reminder that you're on duty. So the chiefs will be able to do all that.
So the chiefs will all adapt to when am I working,
They can.
it's
in
also-
addition to the good, whatever you're using?
Yeah,
Oh,
I
cool.
use that at work as well, and there's employees in San Antonio that I can see if they're working or not. So that gives you a kind of
A broad view.
Yeah, broad view of. You could be in different locations, and you can see the schedules in different cities and states and stuff like that. So, and that's the program that we were.
As a matter of fact, you use that program at work, correct, at UMS?
I have a question. What documents are we gonna be requiring for them to submit for the reimbursement? So is this gonna be on a monthly basis? Is this gonna be on a quarterly, weekly?
I
How's
say,
that gonna work?
I say on a monthly basis, at the end of the month, they'll submit, well, the day after the end of the month, they'll submit. And a week later, you'll
Submit what?
get, their
Timesheet?
rosters. Can I call them timesheets? It's a
Wow.
roster. Out of when am I working? And it'll say who worked, and again, everything's gonna be tracked because of how they call out on the radio, just like the paid staff does. They'll have to be there and they'll have to be making every single call. So there's not a way to, there's always a way.
Yeah, I understand
It
that, but for auditing purposes, for example, when we did the $800 for the COVID for the volunteers,
Mhm.
I required for them to submit the reimbursement for the total, right? And then each person that was receiving that $800, a roster of that person that was receiving it. And also, I believed I requested a copy of their W-9.
We
So
can do that.
we need to establish what documents they are required to submit so that when we get to October, we already kind of have something set in place, and the expectation is that these chiefs need to submit those documentations in order to get paid. And we've had that, constant things where there's some chiefs who do not respond to our emails, who do not send us the information we need. So you're not going to get paid, reimbursed if you don't do that.
Now you're gonna have a bunch of guys wanting to lynch you for their money.
So
It's a little
it's
different.
a little, yeah.
But it's understandable. I mean, I can understand Mariana's side. I mean, documentation has to be in place.
Yes.
And I mean, would it be easier to do it weekly? In a perfect world, it'd be great if you could get it weekly, Mariana. But I mean, on your side, chiefs, I'm gonna ask you guys, could you guys do it on a weekly basis? And I mean, if you say yes, we're gonna hold your feet to the fire.
I think to save Mariana hassle, I think monthly is the best.
monthly?
I don't think they'd be able to submit the stuff weekly. I think,
We
I'm
can't,
sorry.
we
I
can,
know, but some of these chiefs do not,
we cannot have
I
them
love
clock
you
in.
guys,
We can,
but
that
man,
would be ideal, the clocking in, the clocking out, but we cannot have them do that.
monthly would be fine.
But you have to set a date as to when you're gonna.
That's what
run
I'm
it by.
saying. We need to
And
set
if
on
it's not
those.
there, Mariana, I mean, guys, you guys have to understand also, I mean, she's on a timeline that she has to do all her reports on a monthly basis. And if you guys aren't helping her, you're gonna make her job very difficult. So it's a win-win for everybody, but we all have to work together. And by that meaning that she needs to have the paperwork when she tells you guys. Yeah,
And that should be, my recommendation, it's outlined in the SOP, or what do you want to call this thing? I think it's what's this called, Roger?
It's policy. Chief Sasso was the one that put it, but he didn't put it on the letterhead, so it'll be on the SOG.
I mean, it's got to call something, it should be signed, it should be.
So it's gonna be in the
At
SOG.
some level, I don't want to call it punitive in nature, but I can't think of a prettier word. Because I want to say, I think
Well-
on the head, hold the feet to the fire to everyone do. Who's our district representative, who's gonna be handling this as a primary and backup, so.
So commissioners, the punitive damage is gonna be that if they don't submit on time, their guys are not gonna get paid.
That's not a true statement, we're gonna do it anyway, I think.
We can't. We cannot pay anything if
I
they
will-
don't submit.
I will not pay anything unless there's an actual invoice and backup
we're not gonna-
documents. They're gonna get paid from them, but they're just not gonna get reimbursed. And if you don't, so I think we should also do it should be monthly, number one. One warning, you need to submit it. Two warnings, maybe. Third, you're not getting reimbursed. I mean, I know that sounds very harsh, but I don't want to go into the next fiscal year and you're asking me to reimburse you from 6, 7 months ago because you did not do your part.
Do you have outlined how they're gonna turn it in? Is that outlined anywhere?
no. I was just asking if we
The
have,
the same way that we outline for everything else that they submit. Chiefs, how do you submit for everything else?
invoice
Get the W-9s for
for
the
the,
COVID,
mhm,
the roster, if they're active, if,
and a
I-
copy of the check
yeah, and a
Yeah.
copy of the check that we reimburse them
Mhm.
through.
that you paid
through our,
the employee, the volunteer.
Is there a possibility to get
A list?
see somewheres where, in the absence of the chief, who does it every month?
Yeah.
that The assistant chief steps up. You know, we'll say for Clint, someone can grab who's not used to doing it, can grab a policy and fight his way through that. You know, with conversation with Mariana and meet that requirement, step by steps. And I'm sure it's not that hard, don't get me wrong. You know, so junior firefighter Barnes does get paid. I put my hours in. You know.
I think the hardest part here is gonna be tracking the hours, but if we have a system like this, then, it gives the chief a chance just to print out the hours. There's total hours per person, that we're able to pay them for that. I think that's gonna be probably the only difficult part. Other than that, I think everything else is a good plus. Because we already submit invoices. I already have a preset invoice.
And you already have a roster, let's say, for
Yes,
for
sir.
July. You already have a
So we have
roster.
to update
or
our.
who
rosters
volunteered.
every quarter. So.
Yeah, so it's all in
I-
place. It's just,
I think at the end, and this is the way I envisioned it, the first month, 2 months, we're gonna struggle a little bit. But we're gonna fix the little hiccups that we're gonna have. Because everybody's gonna barely get into the rhythm of it, and we're gonna look at it and we're gonna square it away.
October 1st.
But I do agree, well, October 1st. October 1st will be, but they wouldn't be submitting till the end of October 31st.
Right, right.
So November 1st, 2nd, they'll be submitting their first invoice, and the following week, Mariana should be cutting a check to them.
So we have still good time to maybe like a dry run.
Procedure.
Yes.
Roger, I just got one more question. It says in here something about beds. I didn't quite get that. Was there,
That the bed must be made by 9 AM?
is that a stipend? policy.
We don't want, we don't want the beds to be dirty. We don't want the beds to be, so we don't want them sleeping after 9 a.m. We want them up and clean and ready to go. Look, make the station look presentable. So
Should
we're
be-
putting it in there.
Should be 5 o'clock, no?
It's, they have to be up by 6, but everything must be stored away and made by 9 a.m.
I mean, this policy or?
Right, because we want to make sure that they follow that straight across the board. If not, we're gonna walk in there one day and 11 a.m. they're still asleep.
One other thing, Chief, you mentioned that they were going to, when they get to the station, they will call dispatch like the paid guys,
Right.
the staff does. So are they able to give you a report of, you know, who
Yes.
calls in and when they come in and leave and so forth?
Mhm.
Another check and balance, I guess.
Like I said, there's plenty of checks and balances because they'll call out in service. Unit, what's your unit number, chief? 701, in service. And you'll see, because we have recordings, audio recordings of every single call. So if 701 for that 8-hour period went to all the calls, then we're good.
You have a
That,
roster.
that's if you're putting them in.
Because you said, keep referring to the going out on a call, 701's going on a call. What if they don't have any calls? We still have a roster as a backup.
Oh, yeah, again, they're gonna be calling in service, and when they're done, out of service. That happens every day at West Valley. For the last 20, 30 years now, 30 years now.
Nice.
What I do want to add to it, and I'd like to get the chief nod or no, is quarterly have the chiefs prior to this meeting, or not this, it's our monthly meeting?
Well,
No,
well,
to our monthly meeting on 20th there, every quarter have the chiefs an hour prior, break some bread with them and get an update on some of the stuff, not just a stipend, other areas too, but also on the stipend, especially for the first year, see how we're doing. Do we see what adjustments need to be made? Is it working? Do we have a change of response hour? Do we have a change of response attitude? Because, you know, what people doing for volunteer now, we're doing for a stipend, you know.
What are our options is if one department decides they're not doing anything, they're not using the stipend program?
we can't force them. I mean, it's gonna be available to everyone, but from what we're hearing, every department's out there looking forward to this, and even the ones that we're not told, which is Sanelli.
Mhm.
They're looking forward to it. They're,
So do we need to vote on this?
yes. That'll be, I would recommend that we vote on the policy in addition to adding the verbiage that it's 30% in addition to the 800 to make it $1,040,000.
Big jump. We did 20 minutes ago, we were trying to figure out healthcare. Gonna do it, it's insane.
This is for 130 people. Healthcare was for 32.
It's a good idea, it's not cancer.
I'm sorry?
It's a good idea, but it's not health prevention for. I know I'm mixing the pots and I apologize, but if I give a crap, I want to be. Yeah, and I think the policy needs to be tightened up a little bit to where it does cover those quality insurance areas, that does cover the how foods. I'm not asking if we look at it on the staff, but make sure whoever's handling them is calculated, know that they're going to get a product that is attainable, sustainable, attainable food that seems to understand. Not off a .com website where they can say, hey, I gotta, like, these expect to get paid every month, correct? Do we have this off the top of the head? Because all the teams, all the stations, I'm sorry, have enough budget to cover 3 months of this that they have.
That would be up to, I have no idea what they have in their account.
I think most do. Are you afraid to say yes, but no. Okay. I know we don't have visibility. I'm not looking for a monetary answer on that, but is it sustainable within the departments initially for us to provide that capital back to?
I remember with the account, you have to pay for it. It's only using that link. So it can reduce.
If it came to that. If it came to that, but we will never have to find out. Yeah. All right.
I want to make sure it's sustainable within the departments. I know I got it. But if you look for it to be sustainable at the district level, are you guys able to sustain it initially?
All right. We will, I mean, it was agreed though that we were gonna be making changes as we went along. As offered by the departments and by the commissioners, by the chief. Even Mariana also, she will, I'm sure will have some issues that we will have to correct.
Right.
And we'll be going on, moving forward. So I make a motion to approve what Chief Esparza said, to add the 240,000.
Do I have a second? A second by Commissioner Diaz. Commissioner Diaz? Commissioner Santana?
Aye.
Commissioner Barnes? Commissioner Avalos? Commissioner Glidden?
I,
Motion carries. You ready for item B?
I'm ready. Go.
Commissioners, back to regular agenda, item number 5, discuss and take action on adoption of the district's 23-24 budget, proposed budget. Madam Chief Esparza, go ahead, Maria.
Okay, commissioners, I just updated our Dropbox with the items you all approved, which was the employee healthcare for.
Our Dropboxes weren't
Huh?
working?
Is it not working?
Well, on off topic, I need to, I think we're reaching our maximum capacity in our drop boxes. We keep getting that message across the top.
Can you put it on our screen or get us some copies
Yeah.
of the spreadsheets?
I was gonna talk about the offline, Maria. It says I'm at 102% capacity.
I'll take a look at it, and if we have to update it, then. Or maybe they're not deleting all the,
Just, yeah, probably.
I deleted them one time. And answered the other.
no, I'm saying the
Not delete it, save it into our archives.
ready? It's sharing. Can you all see it?
Can you hear me?
Yes.
Okay. So right now, if you all, since you all approved the change on the medical, if you see here, where I have it highlighted,
Yes.
I've changed it to 285-120, which would be the Blue Cross Blue Shield option. Is it the P4, correct? Okay.
Yes.
And I just updated the stipend program from the 820 to the 1040. Okay. Now, option 1 here, this would generate 10,076,000 at the no new revenue tax rate. Okay. What that is, and I believe I sent you all a little explanation of what that was. Okay, this would generate the same income as this current fiscal year, approximately the same. Okay. Now, for this fiscal year coming up, we budgeted in total special projects, 251,161. See it right here. Total debt, including the 2 aerial trucks, we just got the funds for that, just to let you all know, we got those funds today. Okay. And that's included in next year's payment, and that is at 2,062,000. Okay. And our operating expenses come out to $7.7 million right here. Okay. If you choose to go with the option of the no new revenue tax rate, now the surplus has gone down to 38,000. Okay, initially it was at 431,000.
Mhm.
Okay, so with these changes, it's dropped it down. The second option is your voter approval, which would generate a little bit more revenue at 10,171,000. Same expenses, same special projects, interest and debt and operating. That would leave a surplus of 134,488 with 52. And then option 3 is the de minimis rate. Now, if you choose option 3, that does cause us for, the voters may petition for an election if you go to the de minimis rate. That would generate 10,565,228 in revenue. Same special projects, same debt and interest, same expenses. Your surplus would be 527,733 with 52. Your current tax rate this year, commissioners, is at 0.093580, which I believe it was the de minimis rate that you all chose last year. Now, this year, if you do choose any of these options, like I mentioned, there is a surplus.
Mariana, what's your opinion on, the, well, the tax rate is one thing, but the surplus?
Well, the de minimis rate would obviously bring the excess of 527,000. So that's more than I would like to have, because we are also expecting a surplus in this current fiscal year due to employee staffing. Some special projects have not been completed, but they are going to be rolled over next year, so they are going to be spent. But I do have, there is going to be a surplus this current year as well. I would not recommend the de minimis rate because, like I said, they can petition for us to go out for voting. The voter approval tax rate is only a surplus of 134,488 with 52. I know I had mentioned last meeting our pension. I would like to see that paid off, use the surplus to pay off, not the full amount, because the full amount of that pension unfunded is 166,651. So we would use this surplus to pay for that, if that is your choice. Now,
The pensions, as far as the pension, I know in El Paso, it wasn't until very recently that we were fully funded.
mhm.
And it was not, for a significant amount of time. So it's fluctuation, it's typical with
Yeah,
pensions. So
correct.
I don't think we need to, we need to keep up, of course. It'll look good, but we don't have to worry right now about
Yeah.
paying anything to the pension.
This is just an option.
Yes.
Another option would also be you can pay off interest on a loan, an extra payment. That is also an option you can do.
That's only if, on the pension, it's only, even if you pay it off today, next year you'll be back, or the following year back to
A lower percentage.
a lower percentage. You could be at 100 today, but next year it'll be back to 98%, and the following year back to, so in a couple of years, we'll be back to the same spot that we were in.
And the no new revenue brings the lowest surplus of 38,761.
Can you go back to the voter approval?
Yes. Here you go.
Mariana, is there anything in between the voter approval and the minimis rate? Sorry.
Okay, voter approval is here. The minimum rate is down here.
Like a happy medium.
Is there a happy medium? Yes. Sorry.
No.
I mean, I know de minimis is like, great, but voter approval is awesome, it's good, but is there an in between, I guess, is what I'm asking.
No, there's no in between.
I'm sorry.
The in-between is a voter approval.
While the in between the no new revenue and the de minimis, the in between is the voter approval
Yeah.
Okay.
tax rate.
You think?
Have the year's strategic plan, financial plan, I think it'd be best if we set in motion so that we know we're gonna be in 4 or 5 years. Or we go back to the taxpayers and ask, or anything else.
The financial plan will drive this part of, we're driving to where we want that. Start going to be, project, it's an increasing. Oh, but then wherever we look, financial plans will be the drivers. In what reasons, we have both, the law makes that, still, but we need these authorities, who are voting to.
Yeah. I am in agreement with that. I think we do need to establish a strategic plan, 5, 10 years. Financial plan, yes, financially wise. So we can see the expectations for the next few years. And like Commissioner Avalos did mention, give a clear picture to the taxpayer of why we're going to be raising taxes the following year or the years to come.
The only caution that I have there is that if you continue to lower it right now, it's gonna be harder to get up to the 10 cents, and we're capped out at 10 cents. There's no strategic anything over 10 cents. 10 cents is the max. We're gonna get half a cent or 1 cent. That's what we're gonna be at. If we go to 8.8 or 8.6, we're already looking at we're 1.4 cents lower than what we can be. So at the lower we go next year, we will look at it and go a little bit lower, and then it's gonna be harder to get back up there. I do agree that there's some things that we are gonna have to look at. The only thing that I do caution you is we're about to look at the Fabian Station, which we budgeted a year ago, and now we had to hire an engineer, and that might cost us a little bit more money.
That is also a good point.
And-
If we budgeted 1.6, I believe, for the Favens Fire Department, which was a quote over about a year and a half, correct?
Correct, and if we
This
need
next
that
year.
money, we're gonna need to be able to have that money. And yes, we can take it probably off of reserves or off of one of those, but right now, we should be able to budget for that, because we're gonna roll that money over, and it's on the agenda to handle that. Get that going ASAP.
You also have to take in mind, commissioners, that as we're paying off debt and loans, our INS is going lower and lower. So that is why our tax rate did go down, because of the debt that we have paid off.
And next year, we're gonna pay off 3 loans, so it's gonna go lower.
Yes. So that's what's driving the no new revenue rate to be so low right now, is because our INS rate has gone down because of the payment of our leases.
There is a very hard definition of how to do a strategic or a budgetary item here, because over the years, we bought a lot of equipment. That equipment is sitting there waiting on parts that we cannot get anymore. Either I start saying, let's buy more trucks, which we shouldn't. Don't get me wrong, we shouldn't. But there is gonna be trucks that I have to say that these are a necessary piece, whether it's a tanker, whether it's a ladder truck, whether it's something else, and then they're coming. Because if we can't fix one of the tankers at Sanelli because we can't find the parts, then we will have to buy another one. And they might not need one right now. And those are the things that we're gonna have to look at.
So I make a motion on that number 2, the voter approval tax rate.
Motion is to propose option number 2, voter approval tax rate.
Yes, ma'am.
Oh. There is a motion
Oh, I'm
to,
sorry, I don't know. Who was the motion? I'm sorry. Oh, okay.
Before, I'm sorry, before we,
Yeah,
just
I'm
one
good.
more question. Let's say next year we want to budget insurance for the spouse or the kids. How easily can we go back up to, let's say we chose no new revenue? How difficult is it to go up to voter approval rate?
It's harder.
Well, the rates change every year, commissioners, and it's based on the total value of all the properties in, it's a whole. It like, we're all in a, how do I say it? Huh? Like a bubble. We're all getting it from the same.
Okay,
So
all right.
it's based on the properties.
Well, okay.
That's, it's changing. So
goes up
the more homes there
Right.
is, the more property we get. So we are gonna see an increase in properties because what's happening here, there's a lot of growth. So the property are going up, so the tax rate is gonna go up.
Mhm.
It's not gonna leave us in that
Not up
amount.
to us, I
No.
get you. Okay,
And usually when you're trying to bring it up, like from where we're, from that no new, the number one, no new revenue, bringing it up from to a voter approval or even a de minimis, I mean, it'd be harder, don't you think?
I'm sorry, can you repeat your question? From the non-new revenue to the de minimis?
To bring it back up.
So the de minimis rate gives you a $500,000 extra in case we cannot fund a project, or it gives you that cap of 500,000. That's the de minimis. It's always going to give you that.
yeah, so we shouldn't even be asking for that. If we
No.
don't- Yeah. I think, in that case, I second, Commissioner Diaz's, motion.
Would you like to use the surplus for any additional cost on the special projects?
Do we have to give a recommendation on that right now?
Um,
Or could we wait till our next, till our
you
next?
can wait till the next, that's fine.
Yeah,
You,
that way we
right
can-
now, you're just proposing this budget.
Right.
Okay, and then the next meeting that's gonna take place after we do the newspaper posting and let the public know what you're planning to do, then you adopt the budget and you adopt the tax rate. Right now, you're just proposing it.
And I think what would be good if you and Chief can get together and Chief Salcedo also, all three of you, and kind of look at it and propose to what you guys want paid off and stuff, or where the money should go. You guys give us a report. You guys tell us what would be our best bet. You know, we're here. We're the board, but we need your input. We need for you guys to come into us and tell us as a group, hey, this is our recommendation.
Okay,
So if you guys could work on that, please.
yes.
All right.
I have a motion by Commissioner Diaz for option number 2, second by Commissioner Santana. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
Commissioner Barnes,
Without a financial plan for the voters, be fiscally responsible? The answer is no, not this time.
Commissioner Avalos,
Commissioner Barnes. Without having something for the future ready to go.
And-
This is having plan.
and Commissioner Glidden.
I'll go with Barney.
Don't go with me, guys. I just wanna.
No. I think it's a good idea. Excuse me. I think it's a good idea that we get a financial plan or something so we can make a fair decision.
Motion dies.
No, I don't want.
Well, but
No,
that
no,
wasn't the, hold on.
Still attack this.
No, well, the motion, okay, the motion dies, but we still have to.
You still have to choose.
Yes.
Obviously,
have
it would
to
be
choose.
the no new revenue.
That would be, yes.
I'd like to make a motion choosing no new revenue at this time with the caveat that we still have time to build something. If there's something out there that we can be responsible, have a financial plan to carry us, new trucks, new buildings, new repairs. You know, we have a stipend program, we have a health program we're looking at. one or the other or both, you know what I'm saying? I think we're in a position right now, what's gonna be a driver is we're gonna have one or the other next year.
Yes.
And I don't want that, a good idea to die on the tree. I think there's a chance you're gonna recruit some people using the STEC program, and that goes away, they won't, I don't want that. Very long, myself, yeah.
I didn't understand what, that, I didn't understand it.
Okay, I'd like to make a motion to, with no new revenue at this time. And that's all as far as that goes. I'd also like to have an opportunity for identifying two commissioners with the team here to help drive something. If we do need to go up, there's some drivers in place.
24, 25. Right?
Exactly.
For the next fiscal year.
This year, because we still have till when, August? August.
No, till Tuesday.
We need to do the postings.
Yeah.
So,
Apologies.
yeah,
Yeah.
so the strategic plan that you're speaking about, it's gonna take some time
It is.
because we need to gather the data that we
Financial
already
plan.
have.
Yeah.
And then we'll
Yeah.
be able to do something, and it could be minimum 3 years, 5 years. What do you all recommend? We can put that on the next meeting for you all to decide
Okay.
who wants to be in that committee. We can do that. That
Okay.
would be something.
I think it'd be hard to go past, correct me if I'm wrong, you do with this, 3 to 5 years with inflation. It's hard to plan past that time frame with spikes. My apologies for looking at Tommy.
Oh, thank you you're gonna be in the meeting with us. You can help.
She raised her hand. She raised her hand.
So I
Never
can,
volunteer.
I can tell you right now, for us to do a strategic plan for trucks, for any of that is out the door, because either we're gonna plan 5 years in ahead, or we're gonna be buying the way we've been buying. Stock trucks, not custom built, just whatever comes up at the time that it comes up. And we are gonna get into that point. In the next year or two, I'll have to begin the cycle again of a new pumper. And we might have to buy one this year or two this year, and it's gonna be skewed. The city of El Paso, we just had a meeting with them. They're doing the same thing because they can't get any. We're fighting for the same equipment that's out there, and it's gonna be skewed. So even they are dropping their sections of strategic plans because they can't. We can't keep up with the demand. We can't keep up with the equipment side. But like I said earlier, we are having issues still with supply chain, and it's gonna continue to happen.
Our current plan says we have trucks we can't get parts for, our current plan, correct?
Correct. But then we can't get the truck. Even if we buy a new one, we can't get it unless we're gonna wait 4 years for it, or unless we're gonna buy a stock truck.
6 to 48 months. Bill. And I get all that. I get the challenges. I get the headaches and the heartache. So, but I think at the end of the day, chiefs say, hey, we're not gonna get you a truck next year. 3 years, you get a truck. Check the oil in the one you got, you know what I'm saying? But he knows in 3 years, I think we told some chiefs we're getting trucks and then we didn't get them for them. But I think we just gotta put those numbers on paper, and I think that's gonna be our driving factor for probably next year, for what budget, what tax increase we need to, it's gonna drive it right through it. And if we do have to go to the voters, and if we have a smart voter that says, hey, show me. We can show them the chiefs, we can show them the drivers, we can show the cost increases.
That's why I caution you, because even if we have to go to the voters, we would have to be the ones that show and pay for that election. And that's gonna cost money. We might just end up backing up. And every time we back up, that number keeps going lower and lower. That's the cautious part right there.
About the backing up part, get that, but that's something we can discuss when we have the financial.
So, you guys want to make a motion then for option number 1? No new revenue?
Second,
No. Sure, okay, let's do it like that.
let's go back. I'm sorry.
Yeah, no, it's fine.
I cancel my second. No,
You said it.
just for this year.
Sure, sure.
I don't want to get away from. Commissioner, I just, that's 100% correct. If we started living here, it's hard to take that hard first step up, but think we have to have some numbers to support that.
Of a motion to. Was there, again, another
Well,
motion?
I already, had already seconded the motion for voter approval tax rates. Will somebody else make the motions?
Make a motion for no new revenue tax rate for this year.
It's to propose budget option number 1. No new revenue tax rate,
Yes.
okay?
Oh, a second. Commissioner Diaz? Commissioner Santana?
Nay.
Commissioner Barnes?
Yes.
And Commissioner Avalos? And Commissioner Glidden?
Aye.
Motion carries.
Mariana, thank you for, first of all, having prepared all this, sending us the explanations, everything, and having this updated. I mean, I understood it, so you did an
Okay.
excellent job.
I'm glad you did. Thank you.
Appreciate it.
Thank you.
Item number 6, discuss and take adoption of the district's 23 tax rate and authorize the appropriate district officer and officials to take action unnecessary to adopt the same. Chief Esparza. Go ahead, Mariana.
So this is for the proposed tax rate, which you just approved the budget of the proposed budget, I'm sorry. So the proposed tax rate for FY 2023 is the no new revenue tax rate of 0.086457 per 100 valuation. Do I have a motion?
Motion.
Second.
I have a motion by Commissioner Santana, second by Commissioner Barnes. Commissioner Diaz. Commissioner Santana.
Aye.
Commissioner Barnes.
Aye.
Commissioner Avalos.
Aye.
Commissioner Glidden.
Aye.
Motion carries. Item number 7, discuss and take action to ratify the invoice from Innovative Ink and Science and Printing in the amount of $44.55 for the installation of the custom aluminum face letters for the Montana Vista Fire Rescue Station 1. Commissioner, this was talked to with Commissioner Santana. They are the Region 19 buy board, just to ratify that for the grand opening.
Motion approved.
Second.
I have a motion by Commissioner Barnes, second by Commissioner Santana. Commissioner Diaz.
Aye.
Commissioner Santana.
Aye.
Commissioner Barnes.
Aye.
Commissioner Avalos. Commissioner Glidden.
Aye.
Motion carries. Item number 9, discuss and take action on allowing 6 members of the Montana Vista Fire Rescue to attend EMR certification class led by ProAction. The cost of the $600 per student, 6 members totaling $3,600. Fees include textbook, ID cards, background checks, and national registry exam submitted by Chief Esparza.
Motion to approve.
Whoa. Who was the motion?
Glidden, Commissioner Glidden.
No, well. Mr. Glidden.
Do I have a second? Commissioner Diaz? Commissioner Santana?
Aye.
Commissioner Barnes?
Aye.
Commissioner Avalos?
Aye.
And Commissioner Glidden.
Aye.
Motion carries. Just to touch base in case Angie didn't hear it. It's a motion by Commissioner Glidden, second by Commissioner Avalos. Item number 10, discuss and take action on approving the invoice from Doggett Freightliner for the body repairs on pumper 701 in the amount of $6,883.92. Commissioner, this unit was in a small MVA and the insurance did cover all the costs. It's just to ratify the repairs.
Motion to approve.
Second. Second motion, I'm sorry.
Motion by Santana, second by Commissioner Barnes. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
Commissioner Barnes,
Aye.
Commissioner Avalos,
Aye.
Commissioner Glidden.
Aye.
Motion carries. Item number 12, discuss and approve the awarding bid for SC 2022-1102-1 for Socorro Fire Department located 11440 North Loop, the remodel entire front of the fire station, Chief Esparza. Commissioners, as you are aware, you did approve for me to hire the engineer that would oversee that. He did agree to way lower terms after we discussed what his endeavors were supposed to be. So we're ready to move forward with this, and the amount is Empire had come in at 57,623.20, and Master Team USA at 73,000 dollars.
Was Empire again?
I'm sorry,
Empire, what was it again?
57,623. However, we will have to meet with him as he does have a section there that calls for change orders. Change orders are pretty expensive.
Trying to get the price, what that would be? Are you trying to verify if there's a price on that?
If he's gonna be willing to do it for the same price, because it's been over a year.
That's the kid that's the gentleman that sat right here, right?
Yes.
No, aren't they normally 30% higher than master teams?
Yes.
Okay. Is that low?
And that's why I have to review both of the quotes to make sure which one is the one we bid it out.
Okay.
Motion to approve whoever's the best, and bid it on the exactly what we have.
Motion.
Are we voting for which company or voting?
No, I have to review both the bids. And
Can you Send
then
us an update,
I will,
which one you approve?
I will.
Second.
Second. Third.
We have a motion by Commissioner Diaz, second by Commissioner Santana. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
Commissioner Barnes, Commissioner Avalos.
Aye.
Commissioner Glidden,
Aye.
motion carries. Item number 13, discuss and approve the bid for FD 2022-01213-1 for Fabens Fire Department located at 219 West Main to demolish the existing building and build a new metal prefab building. Submitted by Chief Esparza. And again, Commissioners, the bids were open. I'm just going to reread them for you all. Master Team comes in at $1,380,000.
Trying to read this right. Is that to demolish, level and build new?
Correct. And the second one was Empire Contractors at $1,600,000.
Wow.
Again, motion to approve for me to review these and award it to the one that bid what we were looking for.
Motion.
Second.
They're gonna be a similar building as Montana Vista or?
Similar. Similar. Maybe a little bit smaller based on the footprint.
Right.
Have a motion by Commissioner Diaz, second by Commissioner Santana. Commissioner Diaz,
Aye.
Commissioner Santana.
Aye.
Commissioner Barnes, Commissioner Avalos.
Aye.
Commissioner Glidden,
Aye.
motion carries.
On that, not to change the motion, has the chief been with you on, working with you on this?
Yes.
Okay,
What's the ETA?
you don't get a vote.
For all this to begin, Chief?
As soon as I get the engineer and the whoever we award the bid to and to go, we'll get going. Item number 14, discuss and approve the next meeting to take place on Tuesday, correct?
That's a regular meeting?
Are we gonna review the budget one last time? The regular meeting is the 15th and we have to present on the 14th. Would you like to review anything before then, Commissioners?
I think we're,
I say we make our regular meeting the 8th just to review everything one more time and ready for the 14th.
Chief, I need to submit it today. Today was the deadline
Right. I mean,
for the presentation.
fine. Week earlier, is that all right? Okay,
You can make a meeting, but we're probably gonna have to
it'll
have
be a
another
special
one.
meeting, right?
Yeah.
on the 8th? No, I mean, we can, but we don't have to. We can put everything on the 8th.
No, chief, you can't. There has to be
Yes,
the
that's right.
posting of
Never mind.
the text of
15th of the
courier. And yes, like I need to submit
Yes, you're right.
You guys just approved the proposed tax rate. That needs to be notified to the public, and it's notified through online and through our West Texas Courier. So there's deadlines.
So the 15th
So the 15 is fine.
Okay,
at 6 PM.
15.
The motion,
If anything does change, I will let you all know.
So no meeting on the eighth.
No,
Not for now. Yes.
15. Motion to approve on 15.
do you have a second?
Second.
I have a motion by Commissioner Santana, second by Commissioner Glidden. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
Commissioner Barnes, Commissioner Avalos, Commissioner Glidden.
Aye.
Motion carries adjournment at 8:06.